the Himalayas is Bhutan, a tiny Buddhist kingdom in South Asia with a little more than 700,000 people. Even though literacy rate is 71%, majority of the Bhutanese people live in the rural areas. Besides its unique culture and tradition, the philosophy of cross-national happiness set the country apart from the rest. GNH is a philosophy of development with values coined by His Majesty the Great Fourth Jigme Singye Wangchuk. Bhutan became the youngest democracy in the world in 2008 when the fourth king abdicated the throne in 2006 in favor of the son and imposed democracy against the will of the people. Free and sustainable healthcare services has been at the forefront of the national policy and has been given the top priority in the country. Today, every citizen has easy access to free basic health facilities and there is decline in the vaccine-preventable diseases. But other communicable infections like HIV has appeared. So far, 597 cases of HIV and AIDS have been reported in the country, with an unknown number of undetected cases. Since it's not feasible for the government alone to control the HIV epidemic, people's participation for an effective response to AIDS and its negative impacts in the country is necessary.
I was detected as living with HIV in 2006. But that time we didn't meet with any other HIV positive people, and we thought that, whatever it is going through, it's only us. But later on, through the Minister of Health, we could able to meet with other people living with HIV, living around the country, few of them, and then, discussing with them and, learning the issues and the problems. They have also gone through the same problems and issues, and that's how, we thought that it's very important for us to have an organization for people living with HIV that will cater its services to people living with HIV. And also through our own experience of living with HIV, we can actually use that tool as, for preventing HIV among the general population as well. And Lhak-Sam got registered as a civil society public benefit organization in 2010.
His Majesty the Great Fourth issued an edict for people's compassion, shared concern, and joint responsibilities. It was further cohered by His Holiness the Jekempo, Chief Abbot, and Her Majesty the Queen Mother, Gyalum Sangye Chodon Wangchuk, when 5 members of Lhak-Sam publicly disclosed their HIV status in 2011. Later in 2016, His Majesty the King awarded Lhak-Sam with the National Order of Merit in Gold in recognition of its dedication and successful contribution to the goals of health and well-being.
Our mandates and our activities and programs are not only focused on people living with HIV in terms of their psychosocial problems, in terms of their care and support and other treatment needs, but also it is focused towards general population in terms of preventing HIV. While we prevent HIV, then we are also preventing the impact that are being caused by the HIV, like stigma and discrimination, prejudice, criminalization, fear, loneliness, and then demotivation to live.
HIV cases have been reported mostly among the housewives, farmers, and those in the private sectors. Study also shows high incidences of sexually transmitted infections among the gay men and transgender. Because of this vulnerability, Lhak-Sam has included LGBT people in the programs advocating on HIV and AIDS since 2014. It is also during the same time that the existence of LGBT community in Bhutan was pronounced.
The LGBTIQ peoples are completely hidden. There was no information and educations, on their sexual orientation, gender identity, and expression. They have been going through lots of stigma and discrimination, and most importantly, they have been going through lots of fear that their status might be known by other people, by their own parents, and what will be their reactions. Will they accept me as their son, as their friend, as their community.
Tanga gachibe anzume beomose da pogi beoji pogi bere denimete nga gachibe amsugi beji zum anzum beomose ngari kadim chi duake ngara chamchibe debda te amchigi banalo te ngara gi semgi cho da semshi na gachibe na te lobdana joachin da lebitsugi da gogin shimle tabla midela te anale beoda lebitsugi memchu charuchugi memchu pha di chu di te chapsa sue dambe anzum degop tenkangi lashi juinla
Yamanga chunku debdalu ngangara mashe zudi bumgi jinula te ngangara busum chira ek bendike apa ege namsam tribal nga bumzoni ki yama chunku na bewachin but whereas ngagi nera matwa ngawan very dela
the school time nalo the ngai char to sige the school time nalo boyfriend girlfriend so be the ngai char to sige the boyfriend so be the ngan sum na to makpalera mate so ane pepe the ngangara ki the mi madochi mi me nga so chonam chi womme ngalolo dance mo be the rangi char la lab ke san the char ki nga yan mo ti sai ku jonu ansum lab pe nga chi share pe mi so be.
It didn't strike me that I was gay until I was 13, until a guy called me gay, and honestly I didn't know what it meant because the idea of sexuality was still new to me. So I did some research here and there, and I discovered that being gay means you're just interested in men, and I was like, okay, that's me, that's who I am. Still, I wasn't comfortable sharing about myself to my friends.
Over the years, societal judgment on their sexual orientation has resulted in school dropout, unemployment, alcohol and drug use, sex work, and ultimately suicide. And the majority are in the hideout owing to the implications.
I had lots of challenges like name teasing from my friends, and then being a guy having the behavior as a girl. So I really had that hard time, and I couldn't come publicly with female thing like dresses, anything, and I really had that hard time.
I used to have lots of phobia where I was ashamed to go outside of the house, and I used to stay alone a lot of time. So this bullying and all, I thought when I go to high school, no, it'd stop and all. And it turned out to be that the high school, it was more difficult for me, where till now people were like just pinching and all, no, just name calling. And after high school, it turned out to be physical for me, where people would punch me, they would pull me, they would drag me in the toilet, put water over me. And these situations created this thing that I don't want to go to school now. I don't want to pursue my education and all. And I think these situations of bullying, I think these are the things that happened to me.
According to the Penal Code of Bhutan 2004, Clause 213 states, a defendant shall be guilty of the offense of unnatural sex if the defendant engages in sodomy or any other sexual conduct that is against the order of nature. And Clause 214 states, the offense of unnatural sex shall be a petty misdemeanor. Therefore, it has attributed to the self-stigmatization of these key population.
When we talk about Bhutan, we always say Bhutan is a Buddhist kingdom. We take pride in saying Bhutan is the last Vajrayana kingdom. And everything about our country is based and built upon the Buddha's teachings. So we must remember that the Buddha never said that a person must be straight to achieve enlightenment. The Buddha said a person must have emotions to achieve enlightenment. So if you want to, talk about Buddhism, whether you are gay, whether you are straight, whether you are lesbian, whether you are transgender, whether you are Q, as they say it, I guess that means when you're curious and you're not sure, it doesn't matter. You will achieve enlightenment. So keeping that in mind, there is absolutely no reason why Bhutanese, why Buddhists should not tolerate the LGBT community.
So in Bhutan, we are still in the process of sensitizing the policy and lawmakers and law implementers and other high officials who works in the area of policy formulations to create an enabling environment, especially in the area of accessing health services by this group of population without any barriers.
But now, with strong advocacy and education in place, the larger population has come to a common consensus of their sexual orientation.
You know, hearing their stories more made me realize that they are just like me. So that is, I think, a very touching point, because we Bhutanese are saying that, oh, I didn't realize this, now I realize it, and that acceptance is coming out. As I said earlier, we are a society built on Buddhism, so we are capable of loving and being compassionate. So just knowing the story makes people more accepting.
As per the research, because of their nature of sexual conduct, gay men and bisexual men are 19% vulnerable to HIV and STIs, and transgender women 34%.
Of course, even the transmission happened through heterosexual intercourse. That is, hetero is men and women. That is the normal phenomenon. But now, when it comes to MSM, men having sex with men, and then the transgender, they normally have the sexual intercourse. That is anal sexual intercourse. So this is a high risk of contracting all sort of sexually transmitted infections.
With just a minimal amount of domestic aid, the implementation of plans and programs for the sexual and gender minorities has been a matter of concern. However, Global Fund, like multi-country South Asia, has been the most rewarding support system.
It started in October 2014, and it has been very useful fund especially for Lhak-Sam in terms of catering our services and in terms of bringing the LGBTI groups together.
Under the MSc grant, we have outreach and networking activities. So during these outreach and networking activities, what the outreach workers do is they go out, they try to identify people, they try to meet with people who are under the gender minority. If they are comfortable with us, if they are comfortable meeting with people, then only we bring them in for trainings and community forums. And if they're even more comfortable and they're ready to come out and open and express themselves, we give them the platform.
ngaji LGBT chamchi member lo jimi da drawing gi bumso delin da kompa club na gilabe misu ansu ki tinle ngaji gi ani peni is shuni la tanga jigi da goda ji kono lejimbe da ani HIV su mama kata beni gi dinle in se chinsu gan zum la len lejimbe tab go singa jani shik be su da lu tanga ji konsule kangin mi ji khona ge de tijigap ngaji gi da khong kangil juma ji ngaji gi number da ansu jinja be da khongi lam ni la da ana lo khongi na networking form na ansu khongi na jo de kono personal be che be kono lejimbe shik be de form sule la be ani be da lu de ngagi be ji ni sim khali be ji na be dynamics no mila
usually more. The most common route of any STI, the HIV transmission, is sexual route in la unsafe, unprotected sexual route la. Since it's sexually transmitted, bindigi, kakta digadi bin more lavachin use of any the correct and consistent use of condom la. At least 1 month to 3 months ki bana chamchila HIV thop shimle exposed shimle after 1 month to 3 months ki jabkal chamchi dazin la. HIV snal fata jo, or you can go to hospital. BHU snal fata you can meet VCT focal person la be la. And this you can do blood test.
We also have the people who are coming to the testing. We have a good number of LGBTI community, especially the MSM. The MSM, of course, they're in large number, but still it's a little difficult to open up themselves and then come for testing. Nevertheless, we have already achieved the target that we have set for.
ngachi LGBTI chim member ka ere go la da ni ani di kachilo da ani enale tindi ni ani thopsi HIV kole go dati la ngachi ge duduli pe go dati tisu jinsup chi la ngachi mi manglo ni ji de ka de thobina delen kachilo kak thap ka de be go mina dema se ngachi chare sa phalam chi thopchi de lalu chi de mulada dongkha ya themisu lalu chi de delen dongkha thinde yi dele dongkha thema sumi de sudi kachi mo so khura ngo cha yang zan de gi me bala khulu ya ngachi da LGBTI sab dislu ya ngachi ni ji de ani be thop mis de da ansum be da ni be thobis de ani ko le ngachi go da be jin thopchi la.
In the meantime, Rainbow Bhutan, a network among the sexual and gender minorities, also strives towards physical, mental, social, and economic well-being of the key population.
We chose this name as Rainbow Bhutan because we feel the need to include people from diverse population who have diverse needs. As of now, we have 148 registered members in Rainbow Bhutan. MSA grant has contributed in formation of Rainbow Bhutan because it was MSA who started the movement, and it was MSA that built our capacity. I think that's how it has impacted.
While change and development remained inevitable, the manners in which the key stakeholders had to implement the plans and programs under the MSA grant was quite a challenge.
In the national response towards prevention of HIV and STIs in Bhutan, there are a lot of other stakeholders. Among them, one of the important stakeholders is Lhak-Sam.
The government are very much happy for Lhak-Sam to be the sub-recipient of the regional grant and for reaching out and to reach out to the grassroots peoples, the LGBTIQ peoples. However, the problem that we are facing is in the area of stigma and discrimination. In some of the institutions and organizations and schools, when we approach for advocacy programs, they would not allow because they think that Lhak-Sam and the Rainbow Bhutan, the LGBTIQ Bhutan, is actually promoting the Western concept in the country, and therefore we have been facing problems.
Major activities we have under MSA project is first is community forum, then second is treatment literacy, third is outreach, then fourth is advocacy, then fifth is like MSA even used to support in terms of office running costs, and even they used to give budget for monitoring. We have been fully implementing the project with the full utilization of the budget allocated with a greater impact on the ground.
In a country where basic health service remains a top priority, Multi-Country South Asia Global Fund has always made it possible for a favorable implementation of plans and programs for the key population, which has helped in accomplishing immediate and lasting change in their lives. Such aid will ensure a sustainable and quality public health service delivery in the country. Health being an integral part of the GNH philosophy, Global Fund will contribute to achieve its mandate without a nip of uncertainty.